Can abbreviated MRI expand breast cancer screening for high-risk individuals? Imagine a screening tool that could make early breast cancer detection faster, more comfortable, and more accessible. That's what abbreviated breast MRI aims to do. It's a shorter version of the traditional MRI scan, designed to keep the high sensitivity for detecting cancer while reducing scan time and costs. This approach holds promise for expanding screening options, especially for women at high risk or with dense breast tissue, where mammograms might miss some cancers. Research shows that abbreviated MRI can detect breast cancers with sensitivity close to that of full protocol MRI. In fact, many studies report sensitivities around 95% or higher, meaning it's very good at catching cancers early. Specificity, which helps reduce false alarms, can also be comparable or even better in some cases. For women with a personal history of breast cancer, abbreviated MRI has shown perfect sensitivity in some studies, with fewer false positives, making it a reliable tool for ongoing screening. One of the biggest advantages of abbreviated MRI is its efficiency. Because it takes less time to perform and interpret, it can be more easily integrated into routine screening programs. This means more women could have access to MRI screening, especially those with dense breasts, where mammograms are less effective. Dense breast tissue can hide tumors on mammograms, but MRI, including abbreviated protocols, offers a clearer picture and higher detection rates in these women. Current screening guidelines recommend MRI for women with a lifetime breast cancer risk of 20% or more. Abbreviated MRI could potentially extend the benefits of MRI screening to women who do not meet these strict criteria but still have dense breasts or other risk factors. This could lead to earlier detection and better outcomes for more women. However, there are some challenges to consider. While abbreviated MRI improves access, it can sometimes produce more false positives than mammography, leading to unnecessary follow-ups. Proper training for radiologists is essential to interpret these scans accurately and minimize false alarms. It's also important to remember that abbreviated MRI is not meant to replace full MRI in all cases but to serve as a complementary tool to existing screening methods. In summary, abbreviated breast MRI offers a promising way to expand breast cancer screening for women at high risk or with dense breasts. It combines high accuracy with shorter exam times, making it a practical option to improve early detection. Still, its use should always be guided by healthcare professionals, considering individual risk factors and available resources. As research continues, this approach could become a valuable part of personalized breast cancer screening strategies, helping save lives through earlier diagnosis. Always consult your healthcare provider to determine the best screening plan for your specific situation.